so I would like to start off with Anne, who's going to give us just an overview before she talks about the results. But what is three-quarter house, and a little bit of background on the history, and then talk with us about the results of your interesting research, and also how you came about this particular style of research.
Okay. Can you hear me from here? Okay, good, because this isn't moving.
I should just also say that Anne is such an expert. She has a PowerPoint. She's not using it, but it will be available on the network's website probably by the end of this week or early next week.
It's a generational thing, right? I mean, I know that people think this is good practice, but I find it's very inflexible. So I'm really pleased to be here and to have a chance to talk to you. I'm Ann Jacobs. I'm the director of the Prisoner ReEntry Institute, which is one of about 13 research institutes at John Jay College. And our interest is in bridging the worlds of academia and research with policymaking and with practitioners. And in fact, my background is much more as a practitioner, as I think you heard. In my years at the Women's Prison Association, while our focus was on criminal justice, it was very obvious that the problems that our clients were struggling with had everything to do with homelessness, with their health, with their mental health, with their substance abuse, with their ambitions for their families to be reunified with their kids. So it was as much about all of these other systems as it was about criminal justice. So at Prisoner ReEntry Institute, we have a broad range of things we do. We're the intermediary for the New York City Justice Corps. We are responsible for getting CUNY back into the prison system to run a college education program. And we had this opportunity to do this wonderful kind of partnership or collaboration with MFY Legal Services and Neighbors Together, who have had a very long-term commitment and concern about three-quarter houses, and who in fact have been responsible for bringing it to my attention and to others. I left the city in 2008 to try to retire to Costa Rica, and when I came back, all of a sudden, you know, the major a resource that clients coming out of jail and prison were counting on for housing was called three-quarter houses. Well, I started a career when there was a presumption of people coming out of prison and jail through halfway houses, so I assumed that three-quarter houses were the next step in that kind of continuum, and that they had something to do with government, something to do with licensed and standards, and guess what? They don't. So we undertook what we call participatory action research to really find out what the experience was of people living in three-quarter houses. So it isn't quantitative research, it's qualitative research, and it engages the people who are directly affected in helping to design and conduct the research. So we worked with the Tenant Organizing Project, as well as with Neighbors Together and with MFY Legal Services. We conducted focus groups, we conducted discussion groups, we did individual interviews. We didn't actually visit any three-quarter houses or get far enough along to meet with three-quarter house operators. We hope that there will be subsequent phases of the research in which we'll be able to do this, but frankly, we wanted to get started and get something done, and it was an unfunded kind of initiative. So we, and if you're interested in more about the methodology of how we used it, how we did it, there is, the report is online, and or we can send it to you. I've made the executive summary of the report available to you today. So what I'd say about it is that the things that we talk about in the research are true for a significant number of people who live in three-quarter houses. But I'm not asserting that it's cross-representative of everyone, because there is no way of knowing where all the three-quarter houses are, who lives in them, or doing something that is scientifically a representative sample. So in fact, we don't even know how many people live in three-quarter houses. We've taken the MFY and Coalition for the Homeless and others who've monitored this over a while, looked at their lists. that typically have 300 or 350 addresses on them at any one time, and just done some multiplication based on the reports that we get from residents of how many people typically live in these homes, and it could easily be that there are 10,000 people or more living in three-quarter houses on any one day. So what are three-quarter houses and where did they come from? Well, they typically are places that rent beds to single adults. They're often for-profit, less often, I think, run by not-for-profit, although the profit is questionable, as anyone who runs a facility will tell you. They typically don't provide in-house services, although the literature that you see on them or that you'll see in a prison when you're looking at a flyer will suggest that they do, that they provide help with finding housing afterwards, with help finding jobs, with connecting people to treatment. Although they're not governmentally licensed or approved or monitored, they're almost wholly funded, or they are wholly funded by government dollars, because the way that people live there is by paying rent out of their public assistance, so that the rent in the main for people is the $215 public assistance housing allowance, unless they're on some sort of enhanced benefit where they can pay more rent, in which case their rent is more. And what we also learned is that many of the operators charge other kinds of fees. Fees for utilities, fee for cleaning, not cleaning services, cleaning supplies, as well as many of the tenants reported needing to pay for the utilities when they got turned off, cleaning supplies because they weren't being provided, so that the financial investment of the residents is typically more than just their rent. And, you know, people are there in significant measure because they can't find any other option that's available to them for the $215 that they've got to allocate to the rent. The people that are living there are a diverse group, and I think that in a certain sense that they're very much like the clients that you see in supportive housing, but not all of them are always, right? What we found was that there were a significant number of them that were even eligible for supportive housing, but who were not able to go into supportive housing because they weren't willing to go through the homeless system. Most of them had had experience with the homeless system, and somehow, as bad as some of the conditions were that they were reporting to us, they didn't want to go through the homeless system again. They're coming from a wide variety of referral sources, including jails and prisons, parole, substance abuse treatment programs. They're coming from hospitals and from mental health facilities, city shelters, and word of mouth, a lot of word of mouth. When we talk to the guys, in our other programs, they're very excited about coming out to a three-quarter house because they have this sense that they're going to be able to live someplace, have some autonomy, and be able to afford it while they get their feet underneath them again. So what else do we know about three-quarter houses? Well, they're generally crowded. They report living in bunk beds, with as many bunk beds in the facility as possible, often in hallways, sometimes even in a kitchen, sometimes in a closet, often blocking window and other forms of egress. We know that they are generally not compliant with fire safety kinds of concerns. Didn't hear reports of fire extinguishers or proper kinds of egress. And we know that most of the facilities were not institutionally designed and built, that they were like a 2 or a 3 family home with a bathroom that was more appropriate to, a family residence that's now being used by maybe 16 men. Again, with no provision for cleaning in general, except for that the residents need to keep it clean themselves. We were aided in our research by the Furman Center at NYU that was able to compare the 317 known addresses that we had to the building code records. And what they found was that 90% of the addresses had at least one recorded violation or stop order issued by the DOB. So, these are facilities that are known to, that side of government. But that what we heard was that from the residents that it was very common for the operators to deny access to the facilities to anyone that would come to inspect, fire, building, Department of Buildings, and that in fact even parole and others that had a supervisory interest in some of the residents would generally not come in. They'd meet them at the door. There were other reports of unhealthy, infestation of bed bugs was common, mice, roaches, repairs not being made, flooded basements, mold from, in bathrooms and basements. I mean, quite a lot of indication of health hazards. So one of the things about qualitative research is that we also draw the quotes. So I'll just, share a couple of these with you. So we went about a month with no electricity on the second floor, but then we got like a 50-foot industrial extension cord running from the first floor to the second floor so that I could have lights and heat and stuff in my room because we had power strips. Yeah, 3 of those. I worried because you got 5 different rooms up there with electric heaters in them, but they called an electrician and he rewired the building. Everything's on one circuit now. There's 2 circuit boxes, but the electrician cut an extension cord and ran the wire from one box to the other. That's how we got lights in the whole house. I watched him do that and I just said, Lord, please save us. It's a dangerous, real bad situation. So there's plenty to be concerned about just in terms of the physical plant. But when I said that the profit, issue was a real something to consider, even if you do the math, $215 a month times the number of beds isn't a whole lot of money for running a house, utilities, maintaining the place, doing repairs, right? So one of the things that was reported with great frequency was that there are also a requirement in many of these houses that residents must go to drug treatment. And it's a requirement not from HRA, not from parole, whatever, although those might exist too. But the operator of the house was making it a condition of their residency that they go to drug treatment at a provider that they specify. And always the same providers for different facilities, but only a handful of providers in the city seem to be connected to 3-quarter houses like this. And the residents need to bring back a slip for attending 5 groups a week when they start off, and those slips are collected. So while there's no proof, there's every appearance that there might be an illegal thing going on here, right? That, in fact, there is some system of kickbacks between the Medicaid-funded drug treatment and the providers of these 3-quarter houses. And certainly that's the impression that the tenants have. And tenants spoke with some frustration about being able to get a job, but it's in the wrong direction for their drug treatment. So they literally have to decide whether they're going to continue the employment or they're going to continue the residence. And in fact, we heard a number of stories about people who were evicted because they weren't bringing the slips in. And illegal evictions are a common problem in 3-quarter houses that my colleague Matt Main will talk about. So there are a lot of things to be concerned about this, but we also found that there were things about living in 3-quarter houses that people were choosing and that they liked. As I said, they're choosing not to go to the shelter system. They like the sense of autonomy that they've got, even though a lot of the houses are run with at least as many rules as shelters are. They typically have to leave in the morning and can't come back to the afternoon. They don't have keys. But they felt that in some ways being there fostered more independence, more dignity, gave them a chance to practice their life skills. And some people had the sense that it was really a temporary placement because they were working and they could see something else for themselves. But a lot more of the people that we talked to were on a cycle of this three-quarter house now, that three-quarter house then, and then another one. And in fact, when you factor in the connection to the drug treatment programs, what we found is that another way of getting evicted was to complete your treatment and not be bringing those slips back anymore, as if they were now able to go and live independently. And sometimes they reported even being told that when you relapse, you can come back, which is pretty cynical and not the way that I think any of us would have the system work. So there were other kinds of issues that we talk about in the report and that I would, encourage you to look at. Clearly, these are places that are not staffed and run by qualified staff. Often the one person around is somebody who previously lived in the house as a resident and therefore is just kind of a trusted staff person. But our clients or the people we interviewed said that they often are struggling with their own addiction, current use of drugs and alcohol, that they're not therefore creating a sober or safe or even legal place for them to be. So for all of these reasons, we think that three-quarter houses are, on the one hand, meeting a really important need in New York, and we don't want the conclusion of our research or advocacy to be that they should, we should just enforce the building codes and close them down, because that would just create the next crisis of 10,000 people who, need a place to live. And we hope instead that by talking about three-quarter houses, we can recognize that, they're a part of the population that any kind of city's housing strategy needs to address.